I want to talk just briefly about the urgency piece, and you've heard and seen some of these numbers. So this is Wisconsin's population by age 2005 to 2017. The blue line is 20 to 34. When we talk about declining birth rates and nobody's coming into the market, that workforce feeder line is flat. The green line, which is the management class, the up-and-comers, these are the people who've got experience. These are the people who go and buy houses and cars and all the rest of that. That line's been going down in Wisconsin. And the gold line, the over 55 workforce, is soaring during that period of time. There are, just to put that number, that gold line in context, in 2015, there were 605,000 people in the Wisconsin workforce 55 or older. If you didn't get a chance to take a look at it when President of the Board of Regents, Drew Peterson, was talking about his company, TDS Telecom, he said they have 3,000 employees. 1,000 of those people, a third of his workforce, is retirement ready, and they cannot find the people that they need. So that's where we stand now. If you take a look at other states, what you see is the states that we're used to dealing with, Iowa, Minnesota, and Michigan, have similar patterns except for Minnesota, which manage their aging population better retirement programs. I don't know exactly how they did it, but that's a different pattern. What's making this really much more urgent these days is if you take a look at the states that are already beating us with sunshine and ski slopes and whatever else is out there, okay, they're beginning to experience the same pattern, which means that people who've already at work this already have an advantage are going to be competing as well. So the pool of people competing is growing larger and larger, okay? And so we put together a panel which I'm delighted that Mr. Tim Sullivan has agreed to facilitate. Tim and I go back a ways and both had an affiliation with Carroll College. Tim has served as president and CEO of the Rev Group since August of 2014. He, from my vantage point, equally important, he served as chairman of the Governor's Commission on Workforce Investment, wrote a report on the technical college and workforce issues in 2012-13. Tim, is that right? 2012-13? 2012. He's twice chair of the Metropolitan Milwaukee Association of Commerce, and he's brought now, I think, 4 companies to the state of Wisconsin. He cares deeply about these issues and is one of the smarter people I know. So I'll turn the program over to Tim.
I'd like to start with just a couple of comments, and we'll have, obviously, the panel to chime in. Jim asked me to join Cooperative Wisconsin a couple years ago, and he said, you know, what is the burning platform that really needs to be addressed? And I said, when we put the report together back in 2012, I said the state of Wisconsin was using a whopping $410,000 worth of money to train our workforce. That was it for the entire state. Of that, 90% came from the feds, which meant that 377,000 of the 410,000 was provided by the federal government. I currently manufacture a whole cadre of specialty vehicles, primarily ambulances and fire trucks. We operate 23 plants in 11 states. We have a great deal of experience with workforce development, as you can well imagine. And the common denominator there is what's already been talked about. There's money flying around all over the place, and a lot of it's state money. So when I said to Jim and Cooperative Wisconsin, I said, show us the money. We need money to really pull this thing together and incentivize people to get workers to the state of Wisconsin. Just a quick factoid also, and kind of, you know, jumping on the back of what you were talking about, Illinois is the second most shrinking state in the country right now. The first, and it's been consistent, is West Virginia. The coal industry has completely collapsed. But Illinois is collapsing. People can't get out of Dodge fast enough. And it's really not as much job-related as it's quality of life, cost of living, taxes, crime, all the really bad things. And the good news is we're right here. and we've got a target that we can attack.
As we all know, rural and urban Wisconsin employers have begun to experience the retirement of baby boomers in record numbers. What is particularly true in the healthcare sector is that an aging population not only reduces the supply of workforce, but also increases demand, as the need for healthcare really takes off as we get into our senior years. While it is important to note the long-standing challenge for rural Wisconsin communities to recruit healthcare practitioners, the current supply of health professionals is at best okay for our urban communities. In any event, the available forecasts show that both urban and rural will soon face major shortages. Here are a few examples of the impact of current shortages. Current healthcare professional shortages in our rural communities can mean patients wait longer for treatment, get less treatment that is optimal, or receive no treatment. Or it means they leave their community to get needed care, take revenue out of the local community, weakening the local hospital and clinic. It often takes over a half year at best for a rural hospital to recruit a physician. One co-op member in a very attractive location has been recruiting a practitioner for their behavioral health program for over a year with no results. Unfilled positions lead to more pressure on existing staff, more burnout, and more early retirements or loss of staff to urban communities currently without these challenges. When a rural clinic loses a physician, they don't just lose the direct patient care and financial support to the community, they almost always lose a teacher. It is not uncommon for one physician to annually train several medical students, resident physicians, and physician assistants. Without this training, these learners are not exposed to the benefits of a rural practice and are less likely to consider working in a rural community. Rural emergency rooms are often mentioned as the #1 service by hospitals due to rural farming accidents, vehicle accidents, overdose, stroke, and cardiac events. This requires 24/7 staffing, which is very difficult and often requires the use of very much more expensive interim staff from agencies. If 24/7 coverage is lost, lives will be lost and the community less attractive to live in and to start businesses in. Preventable deaths are higher in rural Wisconsin. The current shortage of certified medical assistants can lead to practitioners not having time to discuss important health improvement opportunities such as diet, exercise, vaccines, mammography. But what about the longer term? One that we must address now so to limit the damage of major shortages in the not-too-distant future. To ramp up production for advanced care practitioners like nurses with a bachelor's degree or physicians, it is not unreasonable to estimate 10 to 15 years from starting an expansion of education and training sites to having experienced practitioners in the field ready for a full practice. In that light, we are already in a crisis, as the Wisconsin Center for Nursing is forecasting a statewide deficit of nurses equal to 15% in 10 years, and with the Wisconsin Council on Medical Education and Workforce forecasting a statewide deficit of primary care physicians equal to 14% in 15 years. Statewide figures of this magnitude will hit most communities very hard, but especially our rural communities who, as noted earlier, traditionally experience staff shortages even when times are good. The Federal Centers for Disease Control released a report in early November that rural communities continue with higher rates for all 5 of the leading causes of death: heart disease, cancer, unintentional injury, chronic lower respiratory disease, and stroke. One of the root causes of these disparities is rural Wisconsin's slow recovery from the last Great Recession, leading to fewer jobs and less income, major contributors to poor health. A second is the chronic shortage of rural healthcare workforce. The bottom line, the workforce shortages our state is already experiencing and will increasingly experience will make access to affordable health care unacceptably more difficult, no matter how it is paid for.
Hello, I'm Dan Smith. I'm President and CEO of Cooperative Network. Cooperative Network is an association of 250 cooperatives from 12 different business sectors in Wisconsin and Illinois. In the last 10 years, mechanization, specialization, larger farms, new technology, and new methods of farming, new management systems have greatly reduced the number of farms, have greatly reduced the number of farm families, and have really changed the workforce requirement for agriculture. 1 in every 9 jobs in the United States is tied in agriculture to some way. And that's where we're really seeing the growth for workforce in the future, is in the support systems for agriculture. When we talk to our cooperative managers, they all will point to the need for labor to address their workload as one of their primary concerns. With the new technology that is available, the type of person that our farmers and our cooperatives are looking to recruit has changed drastically. I was speaking to one of our farm co-op managers. He pointed out the window and there was a new crop pesticide applicator, fertilizer applicator parked out there, and he said that machine cost us $350,000 and it runs primarily 4 months of the year. And the person that I need on my workforce to run that operation has to be so technical and so trained to run that piece of equipment that that person could probably get a job any other place, in any other business today. I need to attract that, find that person, attract that person, make sure that the compensation is competitive. And then 4 months of the year, I'm going to ask that person to work 7 days a week, 16-hour days. So I'm at a disadvantage. So I'm competing for the same technical skill, but because of the seasonality of agriculture and because of the constant change that we are seeing in agriculture, I need to retain that person in my business, somehow afford them, and then give them the professional development and opportunities and lifestyle opportunities that any other business can give. And that's a challenge for us. When you look at the impacts on agriculture over on a national basis, if you look back to the late 80s, early 90s, there was great concern in Wisconsin that Wisconsin's dairy industry was losing out to California's. But the thing that moves agriculture systems nationally are two things. One is natural resources and the other is labor. So California's dairy industry was growing by leaps and bounds until they ran into issues with water and they ran into issues with the price of land. As the population in California grew and the competition and price of land became prohibitive, and the cost of water, of being able to use the water that they needed on their farms became too high, we saw a shift back to the Midwest. That really helped bring Wisconsin's dairy industry really seize that opportunity since the 90s. When you look at what are the challenges for the future, so if one of those challenges that we've identified is going to be who's going to do the work, the labor, they're going to move again to where that labor can be found, and access to land. So we are already starting to see some trends of the dairy industry relocating to the Dakotas and to Idaho and to Texas.
As a manufacturer, you look over the last 15 years. 15 years ago, when we were recruiting workers, there were workers to recruit. Then it was a matter of working with the technical colleges, getting the training set up, doing the training ourselves. But we had a pool of potential employees. We don't have that today. We don't have the population anymore. Now it has to revert to recruitment and retention. Some of the barriers that have to be overcome really are a better collaboration between private, public, and quite frankly, nonprofit. And we're here in Waukesha. Waukesha is almost the gold standard for the state. You know, the Business Alliance here collaborates with the technical college and with business in this area to connect all the dots, the students, the need, the requirements, and it really works well. I think the same thing is being done in the western part of the state, La Crosse and Eau Claire. It's being done in the Fox Valley. But it needs to be really raised to a much higher level of urgency. If we don't really get on top of this and really seek out these collaborative efforts, we're not going to move the needle. Things are just going to continue to degrade or deteriorate, and we're not going to accomplish the goals that we need to, and that's getting people employed, recruiting people, retaining people here in the state of Wisconsin. Well, one thing I have to talk about is immigration. I'm a manufacturer. Manufacturing has always been done by immigrants. For 150 years in this country, it'd be the Italians, the Irish, the Poles, the Germans, and now the Mexican Americans. And people don't really realize the fact that there are a lot of legal immigrants in this country. We got to get them to come to Wisconsin. Other states are competing to get that labor, and we're not. We're not even trying. If we don't start going after that type of labor, the manufacturing industry in this state will disappear. The easy thing to do is leave the state. People do it all the time. You know, they end up going to Texas or Mississippi or Tennessee or wherever. They go to where there's labor available. The real answer is business has to step up. The real answer is they can't give up. They've got to engage. They got to be accountable. They got to be part of the effort here in the state of Wisconsin. If they're not, just turn off the lights as the last person leaves. I mean, we have to engage. This is really at a critical stage in our state right now. And I think as we have these pockets of excellence regionally, we have to make sure that those bubble up into something more important that can really be something that is universal and coalesce around the whole effort statewide. Being a city guy, it's easier. I can't really imagine what it's like to try to keep the healthcare industry going in the state. So Tim, maybe some comments on that.
Yeah, a couple things that I hope to come away that this event helps with is that more people around our state understand the house is on fire. I think in rural Wisconsin, we've been experiencing it, so probably that's not as much where the sales pitch is needed. But the workforce issues we're having in healthcare, as I mentioned, I guess in the video, are doubly complicated or impactful because we have people aging out of healthcare, but at the same time, they're aging into being patients and needing the services we have. So, which may be a little different in welding. I'm not sure older people need more things welded, but for healthcare, we're losing people working in healthcare, but at the same time, the demand and need for our services is going up. So I think we have a crisis now, and that's before we start looking at the forecasted numbers I mentioned. You just can't produce a doctor or nurse overnight. It's a lead time for academic institutions to expand. They have been expanding, but we need more expansion. And then, of course, it's the long training time in school and then particularly for physicians in graduate medical education afterwards. So we're already late and need to be working on this. I like sustainable solutions. I like the worker pipeline issue because we know if we can get young people to come to Wisconsin, get to finish their training here, they're much more likely to stay here.
Dan, when you look at getting people to work rurally, what has your organization talked about? What are some of the ideas that you've thrown around to make a difference right now with the shortages that you have?
One of the opportunities that we have is working with 12 different sectors across Wisconsin and Minnesota. When I tell people that, they always say, well, there must be a tremendous challenge because they're all different. But actually, since so many of our cooperative sectors are based in the rural communities, and most have a very strong reliance on a successful agriculture, that they have much more in common than they realize. So when we go out across the rural communities that we work in both states, the access to labor, succession plans for the board of directors and the management, being able to finance the type of new technologies and precision agriculture that are available now during a 5-year downturn in the agricultural economy. Those are the challenges that impact you if you're a credit union, or you're a farm credit association, or your electrical cooperative, or your healthcare cooperative, or housing, or our agricultural cooperatives, because these are all the areas that we work in. And what we're really seeing is a total reset in our rural communities and in agriculture. And it's best demonstrated by one fact, that 40 years ago, in 1978, 41 years ago, Wisconsin had 47,700 family dairy farms. Today we have 7,000. That's 40,000 less family dairy farms in 40 years. But we milk the same number of cows, and we actually produce 10 billion pounds more milk per year than we did in 1978. So that consolidation did not impact production. We have more milk than we've ever had. We set the record at 30 billion pounds. But we did it with 40,000 less dairy farms. And when you work in our rural communities, you see the draining effect that that has had. Because those families, those 40,000 dairy farm families that we lost, they filled the schools. They shopped on Main Street. They served on the co-op board and the town board and the local insurance board. So when we go out and meet with our co-op managers now, and I go into a room, everyone in the room looks like me. They're all in their 60s. There's not a lot of hair in the room, and if there is, it's gray. So they're wondering, where do we get the future leaders? Where do we keep this co-op going in the future? And how do we bring the types of people in who can actually bring the technical knowledge and the skill into into our communities? I recently heard a new term that I had not heard ever before, but perhaps some of you have, but I was talking to a school superintendent, and she was talking about of a rural small community school district. And she said, what I deal with every day is rural apathy. The people that I work with here feel that all the best and brightest have left, and they're the ones that have left behind. Those are difficult conversations to have and difficult solutions to come up with.
This is about discussing collaboration also with the public sector. What have you done to engage the public sector, and what would you like to see more from the public sector in the work that you're doing? Tim?
Not to directly answer, but more general, I totally agree with the issue of greater collaboration. Dennis Winters is here, and you'll be hearing from him in a little bit. He's taught me, and each year I get a refresh on the numbers, that rural Wisconsin has not yet recovered as strongly from the Great Recession. I think we're just now back to where we were when we entered into it. So I think both public sector, private sector, that's an important data point that we need to be aware of. So while, yes, we have trouble recruiting, we also have been losing jobs and losing people, losing populations. So the hospitals and clinics that govern the cooperative, they can have the best health care in the world, but if their community's shrinking, that's not good for them as a business. So we have had good assistance from the public sector in expanding educational opportunities in medicine and nursing, and we need to continue to do that. In the private sector, I think particularly in rural healthcare, and the co-op is getting increasingly more active, we need to get a lot better at cooperating with the other sectors so that they're healthy. So a big priority for me personally, and I think the co-op, is, how do we help regrow the rural economy? And that's a public and private partnership.
And what about you with engagement with the public sector?
Oh, I agree completely with what Tim said. The strength of Cooperative Network is really in the word network. So we represent those 12 sectors in the halls of government and in the public square in both states. There's a reason why our office in Madison and our office in St. Paul is within walking distance of the state capitol, because that's where we spend all our time. And being the voice of the rural communities in state government, being able to represent not just one sector, but 12 different cooperative sectors in support of the cooperative business model, and communicating to our elected officials and to the general public what are the issues that our rural communities are facing. How do we come together, whether it's under the cooperative model or a private ownership model, to address those membership, address those challenges. So our membership really relies on us to be the voice, both not only in state government, but in the public square as well.
Okay, thank you, gentlemen.